COVID-19. We want to look at COVID-19, which is coronavirus. Let us start by looking at what is coronavirus. This is a new virus that causes a respiratory illness in people and animals and can spread from person to person through sneezing and coughing droplets. There are ongoing studies on the origins of coronavirus. However, the current outbreak started in a large animal and seafood market in China in a city called Wuhan. Everyone is at the risk. However, severe symptoms and deaths appear more frequently among older people, people with underlying health conditions such as lung or heart diseases, renal failure, or weak immune systems are noted to be at a higher risk of infection. Now we look at the symptoms that people show or present when they have COVID-19. The first one we have fever, cough, sore throat, running nose, difficulty in breathing, and a lot more others. Now that we have looked at what COVID-19 is, let us see how COVID-19 is spread. The spread of COVID-19. The virus can be spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. A person can still be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, the nose, or the mouth. The virus can also spread in poorly ventilated or crowded indoor settings. This is where people tend to spend longer periods of time. This is because the aerosols remain suspended in the air or travel further than 1 meter. The recommended ventilation should be of this kind we are seeing from our picture. And then also people may also become infected by touching surfaces that have been contaminated by the virus when touching their eyes, nose, or mouth without cleaning their hands. Those are some of the ways in which COVID-19 is spread. It's important that we now turn to the prevention, how one can prevent from catching COVID-19. We say frequently clean your hands with soap and water or alcohol-based hand rub if you can. Carry alcohol-based rub with you and use it often. We are seeing someone washing the hands. Get vaccinated when it's your turn. Get vaccinated. Follow the local guidance and recommendations about vaccination. As we continue with the preventions, cover your coughs and sneezes with a bent elbow or tissue, throwing used tissues into a closed bin right away. Then wash your hands or use an alcohol-based hand rub. We can also avoid touching surfaces, especially in public settings or health facilities. In case people infected with COVID-19 have touched them, clean surfaces clean the surfaces regularly with standard disinfectants. More to the preventions of COVID-19, wear a mask, wear a full-fitting three-layer mask, especially when you can't physically distance or if you are indoors. Clean your hands before putting on and taking off a mask. Avoid crowded places, poorly ventilated indoor locations, and avoid prolonged contact with others. Spend more time outdoors than indoors. In case one has any information that you would like to know about coronavirus, the person can contact the Ministry of Health in Uganda, and the permanent secretary for the ministry is Dr. Diana Atwini. So the ministry's contact numbers are 0800 100 066 or 0800 203 033, and all these numbers are toll free. Call the ministry at any time for any information about coronavirus. Still, you can follow the Ministry of Health on their social platforms. We have Facebook, Ministry of Health Uganda, Twitter at Mini of Health UG, or Instagram at Ministry of Health Uganda to receive accurate COVID-19 news updates. This presentation was presented by Alina Joshua. Email address alinajoshua3@gmail.com, and the contact number is +256 701 52 988 9. Thank you, and that's the presentation about awareness about COVID-19.